So for the lumbar spine, when we're talking about postural training, you know, we're going for neutral. Some people have too much flexion force. In fact, a lot of our patients that come in tell us that their back went out, and their back usually went out when they were bending forward. And as what usually happens, your muscles aren't really supporting you when you're in a more forward bent posture. You have ligaments back there that are kind of like fishing line, and those ligaments over time can wear out just like fishing line does because it's a passive structure. And what usually happens, a person's a little dehydrated, maybe they're a little tired, and they go to bend forward, pick something up. It doesn't even have to be very heavy, and they get some tearing of those ligaments. And then when those ligaments tear, their back hurts, for one thing. It starts off very localized, and then their muscles will tighten up to try to protect their spine. And that's the spasm response. So when they come in here, a lot of times that's what we're dealing with. And we have to be a little careful because just as their back starts feeling a little bit better, they go back to their old way of moving. So one of the things I'll do to educate them on a neutral spine in which they can hinge at the hips more is we'll have them put a stick on their back like this where it's touching their head, their mid-back, their sacrum at the same time, and have them practice doing bending techniques, you know, from that position. And it looks easy because I've done it before, but most people really struggle with this. You wouldn't want a rolling chair behind them, but it is helpful to have a chair behind them, because to get them to do this correctly and actually have their knees behind their toes, a lot of times their weight's so far back, they're not used to that, they don't hinge at the hips enough, and so they would need to sit down and then come back up. So it's as simple as sitting down and coming back up, but we're requiring them to do that at the hips, and it might be the first time that they've ever done that. A lot of people, it can touch their sacrum and their mid-back, but their head can't touch it, or else they'd be doing this. So in which case we just don't have them touch with their head, but just illustrating to them that no matter what they do in life, you know, they can keep this posture through their entire activities at home, and then remind them that their muscles are already trying to train them to do this. Remind them that that day or two after their injury, when they went to brush their teeth in the morning, they were doing it kind of like this. Or when they went to sit down that morning, they were kind of doing it like this. So the body's trying to make them do that anyway. Is what we say is give the body what it wants before it asks for it. Start moving like this in order to allow that to heal. Now that's not to say that we want them to lose flexibility. We do want to work on flexibility, but we want to do that in a non-weight bearing fashion. We'll do that more in a gravity eliminated position. Same thing would apply if we're sitting in a chair. We would want to be back like that, squeezing the hips back there, and then all the way in like that. And maybe getting a little closer to their steering wheel in their car, and just being in a more neutral posture. Now that's for your typical back strain. Somebody that has irritated joints, that would not be something that you would need to probably emphasize as much. In that person's case, you would probably have to emphasize using more of their abdominals to do an abdominal set, squeezing the glutes. So when they're standing, you would want them to be just maybe a little bit tilted to unweight the joints and the nerves in the back. And again, that's a different story than somebody that's bent forward and suffered a back sprain. So in general, that's the kind of body mechanics training we're giving, and it does depend on what category they're in. The first category was your inflammatory response, and if a person has more pain going backwards like that, then and it's more of a chronic situation, then the instructions are a little bit different, and again, it's unweighting with the abdominal muscles.